Hey, February is American Heart Month. Heart disease remains the leading cause of death in the United States. So important that we get our checkups. San Diego-based medical expert and regional medical director for Blue Shield of California, Dr. Scott Flinn, is here to discuss heart health and the tips for us all to stay healthy. Thanks for coming in, doctor. Sure appreciate it. Let's talk a little bit about the signs and symptoms you may be having a cardiac event first and foremost. I mean, we just had the Super Bowl, a lot of fried foods, and a lot of good stuff was eaten, but it can be a little hard on the heart, right?
Yeah, the typical symptoms of a heart attack is chest pain. Substernal chest pain feels like an elephant sitting on your chest.
Okay.
That crushing substernal pain that you get, big deal.
That's when it's time to call the emergency.
Yeah, do not hesitate. When you feel that, you call 911 right away. Minutes matter.
They do, yeah, that's for sure. Signs and symptoms are maybe a little different for men and women.
Yeah, in general, men feel the typical chest pain, which is that crushing substernal chest pain. Sometimes it'll radiate up into the jaw or the left arm, maybe the right arm. Women may not get those same symptoms. Up to half of women present differently with just the left arm pain and the jaw pain or right arm pain or just not feeling well.
Okay.
And if they get that, you feel, boy, there's something really bad happening. Call 911.
Take action immediately. What should you do if you think someone may be having a heart attack? You said call 911, but it's also on us to be aware of those signs and symptoms of our loved ones, right, and friends.
Absolutely. Again, do not hesitate. Do not be shy about that. This is not a time to think, oh, geez, maybe they're just having a spell. No. Get that emergency system activated.
Before it gets to that part, that far, there's some things people can be doing here today, just at home watching this, to stay heart healthy, right? What can we be doing to help out?
Well, some general recommendations that are very important. Number one, exercise.
Yeah.
And exercise, it's 30 minutes a day, every day of the week if you can, if not at least 5 days a week. And it doesn't have to be continuous. The research shows you can do 10 minutes at a time, then another 10 minutes, another 10 minutes. You don't have to get it all in at one time, but it's only 30 minutes, and you're worth 30 minutes a day.
I was going to say, your health really is. Find a good, consistent time to do it. But like you said, if you can't do it all at one time, spread it out throughout the day. And for that half hour, I mean, you got to be moving, right? You got to
be moving. You want to be moving well enough, even a brisk walk up a hill or something where you're just a little bit, I can't carry on a normal conversation, but I'm moving.
Yeah. Okay.
Motion is lotion. Keep moving.
There you go. Keep it moving. Heart disease, how can someone know if they're at risk for that? Is it in the genes, or how does that all work?
Yeah, genes are very important. Also, important things are your blood pressure. Know what your numbers are, especially when you're over 40. Know what your blood pressure numbers are. Hypertension is a silent killer, and it's easily treatable. There's lots of great cheap meds out there to help treat it. Get it treated. Get it treated now. Time is of the essence, and talk to your primary care physician about that. The other thing to know is cholesterol, lipids.
Yeah, sure.
Yeah, and a lot of that is genetic. You can modify that a little bit with your diet, but a lot of it is your genetics. So if you need treatment, get on the treatment for that too. You got to know your numbers. Talk to your primary care doctor about that.
Absolutely. There's lots of resources out there, but make sure you're going to the right place. Can you steer us in the right direction?
Yeah, there's a couple of good places. We at Blue Shield have something called Wellvolution, which helps wellness benefits that can really help you for that. And also American Heart Association has some great resources out there for you.
Okay, and then you can always get in touch with where you're at,
and
right?
of course, your primary care doctor. Always the best one to get that personalized care plan just for you.
All right, take care of yourself, especially here in February. It's not just a month of hearts. It's a month of watching out for your heart.
Yes, heart health, very important. Number one killer. Most of these are preventable. So take care of yourself. No one cares about you like you do. Take care of yourself.
Absolutely. Dr. Flinn, thank you for that wonderful message.